The United Nations has warned that declining global funding is placing a growing pressure on humanitarian operations worldwide, forcing aid agencies to rethink how critical interventions are sustained. In Nigeria's northeast, one of Africa's longest-running humanitarian crises, millions displaced by years of insurgency still depend heavily on humanitarian assistance for survival. To examine the impact of recent U.S. funding cuts on relief efforts in the region, we are joined by the Executive Secretary of the Yobe State Emergency Management Agency, Dr. Mohammed Goje. Mr. Mohammed, thank you so much for joining us. Now, how significant is the U.S. funding cut to humanitarian operations in Yobe State and the wider Northeast?
Thank you very much for having me. And to start with, U.S. humanitarian funding cut has affected not just Yobe State, but the Northeast at large and also the country. But then that is something for us in Yobe State. When we received the information on the proposed funding cut, what the governor did at that time was to direct us to ensure that we did a deep dive assessment to see the gaps, make an analysis, and see where the government can come in and how government can take up the primary responsibility of saving lives in terms of humanitarian needs. And after the assessment, most of the partners that are affected, UN partners, WAP, UNHCR, and other UN agencies were deeply affected. But then that does not stop life-saving activities. Government has did assessment, and we have taken over most of this responsibility. But of course, it comes with enormous challenges. Coming at the time when budget has already been passed, this calls for review and also to ensure that, especially life-saving support of children under 5, food basket assistance to displaced communities, and communities that are just returning is not hindered. So at the moment in Yobe State, we are working with the document that we have reviewed, the gap that we have seen, and looking at the humanitarian need assessment that was just launched recently, and the food security and nutrition needs of that population. These are indices and numbers that we are working on to see that government has complemented. But of course, apart from the US funding, there are other funding sources that we are now leveraging on to ensure that we have maximized and closed the gap. Recently, His Excellency Mohammed Goje has sat down with ambassadors across 5 to 6 countries, Germany, UK, Qatar, Saudi, and other countries. And this is an opportunity also to strengthen collaboration across other countries to ensure that resources are mobilized to close those gaps. But funding, US funding doesn't only stop in Nigeria. We're looking at all the global challenges, the resources and funding shrinkage has affected. There are so many needs, and the funding is shrinking. But we hope that United States and other countries will resume and funding will continue. But that in the evidence, government will continue with its primary responsibility of saving lives and protecting the vulnerable.
Right. Doctor, we know that there are various sectors, but can you specify in terms of the critical sectors, which of these are the most affected by the funding reductions?
Yeah, most of the sectors that are affected by the funding reduction, it has to do with nutrition, life-saving support to under 5. But as I said earlier, government has done the assessment. In terms of education, Ministry of Education were linked to close the gaps. In terms of health, primary health care and Ministry of Health were given the data to close the gaps. And in terms of other major interventions that involves like mobile clinics and other access to basic healthcare services, government is mobilizing alternative funding or the program funding from other sources, the EU, the Germany, and other sources that are available to complement those gaps. But of course, at the long run, we are hoping that funding will resume and life-saving will continue.
I mean, by the look of things, and I stand to be corrected, but by the look of things, it doesn't look as though from the U.S. especially, that would be something that would be kickstarted immediately. So you did mention that you have reached out to various embassies, including Germany as well as the European Union. How prepared are state agencies, such as the YSEMA, to fill the gaps left by the reduced international donor funding?
The advantage we had is over time, Yobe State government has made it very a law that for any partner that comes to the state, there must be localization, there will transfer of capacity, and government should lead from the front. And thankfully, we have developed enough skills over time. We have learned how to genuinely support our communities. And this has given us the opportunity to now look inward, use our skills that we have acquired, and also deliver on the expectations of the gap that has been noted. And when the limited resources that we have, the skills are there, and we've already identified the gaps. We have the numbers, we have the locations, and all we need to is to reprogram and reprioritize this funding to key into those gaps. But of course, we may not completely close the gaps, but these are responsibilities for private responsibility of the government, and we must do whatever it takes to ensure that we have saved lives and we have continued providing the best for people.
Doctor, you mentioned in your answer just now that you have the numbers and you have the regions. Are you in a position to disclose the number that you have at the moment?
Yeah, the humanitarian need assessment recently conducted nationally shows what the numbers for Yobe and the Northeast. The numbers are there. We're looking at supporting and saving lives of over 250,000 people in need. That will be under 5 pregnant mothers and also IDP population. And these are the numbers based on health, education, and nutrition. And His Excellency Governor Buni has already given the mandate for Ministry of Health to take over the responsibility of under health, Ministry of Education to continue with education, and other line MDS in terms of water and sanitation, nutrition, also key in and complement and close those gaps. And as I speak to you now, with the available resources and government funding, most of these gaps are being triangulated to ensure that the impact is not widely felt across those communities. Doctor. And most when the United Nations informed us, the Yobe State government, that there is a decrease in funding, the first thing that the government did was to get a common compound for all United Nations organizations so that they cannot pay rent. Let them stay, even without this, let them stay and continue technical support so that government will do the transition, and that transition will be smoothly. But of course, the funding cut from the US is a big gap, but there are other alternative fundings that we are maximizing on.
Doctor, if I may, I didn't want to disturb you while you were giving me an answer. I didn't hear the figure that you had specified. I said
250,000 people in need across different sectors based on the HNP that was recently launched in Abuja in the House.
That's a very big number. Now, what risks do prolonged funding shortfalls pose on security, on stability, and post-insurgency recovery in the Northeast?
Yeah, funding cut, these are things that when donors come into a state, they have a timeline, they have a lifespan. And it's the responsibility of government to know that no matter how long they stay, they will be exiting one day. And that knowledge has prepared government, especially in Yobe, to prepare on unforeseen circumstances. And this is what we are witnessing now, the transition. And in terms of affected streets, we're witnessing a relative has already returned, doing their normal businesses, and unlike before, today up to 12 p.m., 1 p.m., you will see people going around their business and activities. And this is going to be sustained through continuous engagement, community engagement. People have returned to their homes. There are community policing. There are public services in those communities that were hitherto affected and completely occupied by the insurgents. So we maintaining those security situations in those states requires consolidating on the gains required by humanitarian funding over the years. And this is what the government is doing. And that's why even at the beginning, we didn't allow any gap for partners to lead and implement. We make sure that they come with their plan, government takes up the plan and lead in the process of implementation so that whenever they exited, we have the know-how to continue and complement the gap. But globally, humanitarian response is something that comes through partnership, not just government alone.
Thank you so much, Dr. Goje, for your insight and time.